If you're watching this video, chances are you need to help your cat to eat with assisted feeding. I do not like to call it force feeding because I'd like to think that you can reach some level of cooperation in this process, which is part of what I teach in my Jumpstart program. Now, I'm great at syringe feeding. I have needed to master this practice over the years to save my own cats and my clients' cats multiple times. I have learned about it, I have practiced it, I have made the mistakes and grasped the tricks and got the finesse and so on. But when things have not been necessarily smooth, I have struggled before getting to overcome these additional challenges. And I know that it is not easy to assist feed certain cats in certain situations. And if you are here watching this right now, I want to help you. So we're going to talk about 3 situations where syringe feeding is more challenging than usual and what you can do about it. Let's discuss. Hello, lovely cat parents. If you don't know me, my name is Paola Zanibelli Davis, feline wellness specialist, and I'm here to help you and your cats live extraordinary lives together by unlocking the secrets of natural remedies and positive training, and by teaching you how to provide your cats with high-level cat care right at home, because not having alternative options should not be an option. If you find this information useful and empowering, like this video, subscribe to my channel, simply stick around. I would love to see you again around here. Now, today's video is going to be quite raw because it's tired land over here. I am in one of those phases that I have talked about before. The 5 phases of facing a health challenge, which are emergency and troubleshooting phase, which is the first phase when something hits you in the face. And then there is the phase of planning and adjusting. The third phase would be the maintenance phase, and then followed by recovery phase, and hopefully the cruising and monitoring phase. So yes, I have fallen into this emergency and troubleshooting phase last week, so I am extremely tired at the moment, and I am running around trying to face the emergency. So I have 5 cats, and I have been giving intensive care to one of my cats, and we have been doing very well. But it's quite a bit of work because I had to put in place a particular protocol for him. And then recently, 2 of my other cats came down with a bug, and obviously they will need to be assessed and supported. Maybe I will have to have a look at their immune system again and make some changes. But unfortunately, sometimes the thing happen, and they came down with a bug, and they have been they've been quite poorly. So I have had to fend for the emergency, and obviously they stopped eating because as soon as a cat is not well, they stop eating. And I have been putting together a routine, and over the last few days, it has been quite challenging. So I am just going to talk to you about this topic because I really want to help you. And even if I don't have a huge amount of time today to dedicate to this video, I still want to put something out there so that you can get some help if you are in the place of needing it. So why do we need to talk about this? Because complications in this process, which is syringe feeding or assisted feeding, can cause cat parents to doubt their skills, and they eventually can give up. And this obviously causes their cats to get worse and fail to recover. So what we're going to talk about today is some of these situations when syringe feeding is not necessarily straightforward. There are definitely cases when assisting your cats with feeding can be quite difficult, and I want to encourage you to keep trying and keep going because it is literally life-saving once you get it right. So don't get discouraged. These situations happen, and you are not alone. So it's a matter of putting your head straight and trying to face the challenge that you have in front of you with the best attitude and with honing your skills as you go along by practicing more and more. So some of these situations are, for example, mouth issues, nausea, and, for example, breathing issues. Now, there are plenty of other situations where syringe feeding is more difficult. And one of the most common issues cat parents have when they find assisted feeding challenging is the fact that their particular cats are not very easy to handle, and for example, they clench their mouths, or they don't want to be handled at all. So this is a very valid reason, of course, that makes syringe feeding a bit more challenging, but cooperation can definitely be achieved. And obviously I cannot teach you all that goes behind getting your cats to cooperate with you in a short 10 minutes video on YouTube, but my Jumpstart program does help you with that. There is training that goes with that. There is your mindset is very important, and you need to know the elements that you need to put in place, which is a much longer conversation. The Jumpstart is tailored to you when you're facing a situation where providing home care for your cat at a high level is advisable, because it can save you stress, cash, of course, and it can help your cats get better, giving you the maximum amount of control and peace of mind that can be reached in tricky situations where health challenges are present. Now, it also aims to literally jumpstart your cat's health by teaching you the skills that you need to move through difficult times with your sanity intact. So we're going to use the team formula to discuss these three situations, and the team formula addresses 4 elements, hence the word team, which is an acronym of these 4 elements, which are technique. T stands for technique, E stands for equipment, A stands for attitude, and M stands for metrics. Now, these elements are all important when you approach syringe feeding, because without the right technique and without the right equipment and without the right attitude and without jotting down everything that happens, is very difficult to succeed. So these are the elements that will help you when you face syringe feeding and you have to practice syringe feeding and get better at it to support your cat's health. So these are the main things that you need to look at when you address syringe feeding, even in situations when things are a little tricky. But for example, having said that, when you have mouth issues, for example, which is the first situation that we wanted to address, you are going to know about this because we're talking about here dental issues, stomatitis, ulcers, for example, all those conditions that make the mouth of a cat painful and full of discomfort. So recognizing these signs of oral and dental issues in cats is really key to ensuring their overall health and their comfort, because these problems can really impact their quality of life, unfortunately, and to the point that they can stop eating and hence their syringe feeding. But then it becomes difficult because they are sore in their mouth. So obviously this is one of those situations where assisted feeding gets tricky. So the signs that you might see when your cat is experiencing mouth issue, as we were saying just a minute ago, are, for example, bad breath. You are going to, of course, you were not expecting a cat to have a breath that smells like mint, unless they have just munched on mint leaves. But otherwise, maybe you have a nice cat garden at home. But obviously, if they have a particularly bad breath, that would be a sign that something can be wrong in their mouth, and a sign that maybe there is some dental issue there, and maybe periodontal disease or tooth decay or other things. So another thing is difficulty eating or loss of appetite. So sometimes when cats stop eating is because they actually find it really painful, and they look at their bowl and they will walk away. They are hungry, but they would rather not eat than sustain the pain of eating and getting food inside their mouth and having to swallow food through a mouth that is sore. So if your cat seems to struggle when they're eating and they chew or maybe on one side of their mouth, and maybe they drop food when they're eating, or maybe they just show less interest in food, this can all be due to pain or discomfort in their mouth. Another thing that you can see is pawing at the mouth. Cats can paw at their mouth, or maybe they rub their faces against object or even on the floor when they are experiencing discomfort in their mouth. And then you can see drooling, for example, so excessive drooling, and especially if the saliva is sometimes tinged with blood. This is a very common indicator of oral pain or dental issues. There is also some visible tartar sometimes that you can see, or maybe discolored teeth, and that line of red that you can see at the base of the teeth, that can be a sign that there is discomfort there. So some brownish or yellowish buildup on the teeth, and any sign of tooth decay basically can point to dental problems. Another thing you might see is red and swollen or bleeding gums. So any inflammation that involves the gums is meant to be quite difficult to stand, and it's quite painful. So this can be a sign of gingivitis or other gum diseases, stomatitis, etc. So remember that there are a lot of dental issues that are not visible. Sometimes teeth look quite normal, but it's actually under the gums that you find these issues. And sometimes about 70% of dental issues reside under the gum. So you want to make sure that your cats get checked and periodically, and they eat the right things so that they keep their teeth healthy. And we want to make sure that we point out and we realize when there is something wrong with the gums. Also, there are loose or missing teeth, for example, and if you see that, this can be easier to spot, of course, in cats that will allow you to look at their mouths, but sometimes you do see fangs missing, and you do see that your cat has lost a tooth, for example. So loose teeth can cause significant pain, of course, and eating difficulties. So that's another thing that you can notice. There are also signs like changes in behavior, like increased irritability or decreased interaction, or any change in normal behavior can be a sign of pain from dental issues. Also, weight loss. Sometimes the weight loss follows the fact that cats don't like to eat anymore because of the pain in their mouth. This can occur when the oral discomfort is so bad that it leads to reduced food intake over time. So if you notice any of these symptoms, it is actually a good idea to consult with your veterinarian, and because they can, of course, perform a thorough examination, and also they can provide treatment. They can make a dental cleaning, which probably is better under anesthesia, because, as I said, some things some problems reside under the gums. Sometimes your cat is not really eligible for anesthesia, and then in that case, prevention is obviously better than cure. And there are other things that you can use to alleviate your cat's mouth pain, and we can talk about that in another moment, but at another time. But addressing dental issues promptly obviously is important to try and alleviate the pain, but also to prevent more serious complications. And if you find yourself in this situation, you might be dealing with one of these cases where you have to assist feed your cat, and you find it difficult because of the soreness that they have in their mouth. So another issue in other situations where it can be difficult to syringe feed your cats is when they have nausea, because there is nothing worse that force food inside their mouth and inside their system when they actually do not feel like eating. They will try to refuse it more often than usual. And nausea in cats can be quite tricky to detect sometimes, because the cats often try and hide their discomfort. But in the Jumpstart, we address how you can actually point out and spot those signs of discomfort, even when cats try to hide them and appear normal. So it gives you a really good understanding of what to look for and what to be careful of. And so being an attentive cat guardian can obviously give you an advantage to spot these several subtle and also the more apparent signs that might indicate that your kitty is feeling nauseous. But of course, this can be a tricky situation when you have to syringe feed your cat. And there are some symptoms that you can watch for. For example, there's going to be some lip licking and some excessive drooling. And for example, cats can lick their lips more frequently or drool excessively when they feel nauseous, or there can be an increased degree of swallowing. So you might notice that your cat swallows more than usual, and which is a response to actually excess saliva or the unpleasant sensation of nausea. Now, there is also obviously loss of appetite, and this is when you then need to syringe feed, even though your cat is going to smack their lips and show you that they are quite displeased with your intention. But this is actually one of the things that happen when they are nauseous. They stop eating, and that's a problem. So loss of appetite is a sign of nausea. A sudden disinterest in food, especially if your cat normally has a healthy appetite, this can be, as I said, a sign of nausea. So another sign can be restlessness or lethargy. So nauseous cats can seem restless or unable to find a comfortable position, or sometimes they just become really lethargic because they just feel so unwell. I mean, think of when you have massive nausea and all you want to do is lay down and stay still. So another sign that can tell you that your cat feels nauseous is vomiting or attempt to vomit. So vomiting is obviously a sign of nausea, but you also can see your cat heaving or retching without producing anything, or sometimes they produce just a tiny amount of saliva, and maybe you realize that it's been a few hours without eating, since they ate their last food, and this can mean that they've started to get nauseous. And sometimes giving them, if this happens often, this can be something that you can address by giving them a little treat or something small before their next meal. But obviously, if this is something that happens on a regular basis, it's better to obviously take them to the vet. There are also change in vocalization. Sometimes some cats meow in a certain way, yowl, or they make noises that indicate discomfort. And sometimes this happens just before vomiting. This can be a sign of nausea as well. And then there is hiding. Cats that feel unwell, and including feeling very nauseous, sometimes they hide more than usual as a way to cope with their discomfort in solitude. This is what they would do in nature. So in this case, you are going to have to syringe feed, very, very likely, because cats that feel very nauseous simply stop eating. So at that point, you have to make sure that the places in your house where your cats might go hiding are still reachable, because if you need to give them some food and you need to assist them with your syringe and the blend, etc., then you need to be able to reach them and gently pull them towards you and do the procedure, and then put them back where they want to rest. So don't have places in the house where your cats can just go and hide for days and you can't actually handle them, because these places are not good for their morale and they are not good for their health either. So also, you can see abnormal posture. So sometimes your cats will have a They will adopt a hunched position that can be like a protective posture and position when they're feeling sick. So these are all signs that can tell you that your cats maybe are feeling nauseous. Now, we also have another issue that makes syringe feeding difficult. There are others, but the ones that we're talking about today, which is breathing issues. So breathing issues is something that is so delicate. It can be caused by many things. Sometimes cats have breathing difficulties because there are respiratory issues like a flu or with discharge, and so there is congestion. But sometimes it is a blockage. So we are going to talk about it right now. So, for example, you might see increased respiratory rate, and so normal breathing for cats should be smooth and almost unnoticeable. So if you observe that your cat's breathing seems faster than usual, especially when they are at rest, this could be definitely a concern. And remember that breathing issues, and particularly when your cats are, you can actually see that they're struggling to breathe, and their breathing is actually visible, and sometimes they open their mouth and to breathe better. This is always an emergency. You always have to see the vets when this happens, because this can escalate so fast and it is very, very serious. So you need to make sure that you checked if your cat has fluid in their lungs, for example, or maybe they have a upper respiratory infection, and whatever is, or maybe a heart issue. So whatever is the underlying cause, it needs to be addressed and fast. So make sure that you notice if your cats are not breathing normally. Now, if you notice that your cats are breathing faster, you should definitely count their breaths per minute. So 15 to 30 breaths is considered normal, and more than 30 breaths, obviously it's very individual. You are going to know your cat, and obviously you want to make sure that your cats are as usual, but generally speaking, between 15 and 30 breaths per minute is a normal range. Over 30 is probably a sign of concern. Now, difficulty in breathing, any sign of labored breathing can include open mouth breathing, as we discussed before, or heaving sides, or the abdomen moving more than normal during breathing. In fact, this is one of those things when cats lie next to you, maybe for a cuddle, and you see the abdomen contracting in a certain way that is a bit more with more effort, and you weren't used to see this can be a sign of labored breathing and issues with breathing. So you definitely want to address that. And also, some cats also stretch their neck and head outward, or they adopt a crouch position to breathe more comfortably. So that also could tell you that there is a breathing issue at that point. So another sign that you might see is coughing. So whether it is a sign of asthma or maybe another respiratory issue, coughing is not normal and should definitely be investigated. And then there is sneezing and nasal discharge. So of course, frequent sneezing and any discharge from the nose, these are signs that you have to watch out for. These symptoms might be more noticeable in conditions like upper respiratory infections and flu and things like that. So you have to make sure that you keep an eye on that. And then, and of course, you can understand why this would make syringe feeding more difficult, because when you imagine that you have a cold, you tend to breathe with your open mouth. So if somebody was putting a mixture of food down your throat, at that point you sort of feel that breathing is even more difficult because you don't have the nose to use to breathe in. So it's obviously something that we want to address at that point. It is one of those situations where it is a little bit challenging. So another thing that shows you that there are issues with the respiratory tract, it's wheezing. So a wheezing sound when your cat breathes out could suggest a blockage or inflammation in the airways, and it is pretty common in asthma, for example. You also might hear a sound called stridor, which is a little bit more of a high pitch sound, and usually associated with breathing that is maybe caused by an obstruction or narrowing somewhere in the upper respiratory tract. And usually this sound is more noticeable when a cat inhales rather than exhales, but sometimes it can be heard through exhalation as well. Now, recognizing these signs is very important, because they can indicate a condition that might require an immediate attention. So for example, whether it is a respiratory problem, an upper respiratory infection, or maybe a foreign body that is lodged in the nasal passage or in the windpipe, or maybe even an allergic reaction that is restricting the air passages. Well, this can be even caused by growth or tumors, which sometimes are benign. They don't necessarily need to be malignant, but all these things need to be addressed, because of course a problem with breathing is a serious problem. Clearly, we can't survive without air. So, and your cats can't also. So obviously we want to make sure that as soon as we spot a problem with breathing, we address it. And again, if we are in a situation where we have a cat that is affected by an issue with breathing, and then we have to get to syringe feeding because they sometimes they don't have an appetite, then at this point it can be quite challenging. Now consider checking their gums in this case, because when there are problems with breathing, you definitely want to see if there is lack of oxygen in their tissues. So if you are looking at their gums, that's easy to see. If their gums are very pale or a bit bluish, then it tells you what stage this issue is at. And of course, if there is a change in voice, or a particularly increase in effort to breathe, or maybe some lethargy that is not normal, all these signs call for a swift action that needs to be taken. So, and as I said before, changes in vocalization can show that there is something going on in near their vocal cords. So we definitely want to make sure that we spot that, and we we pay attention to those signs. So there are some issues with lethargy and reduced appetite that is caused by respiratory issues, and then it becomes an issue in itself when you have to then syringe feed, and you obviously have the respiratory issue on the other side. So with all these conditions, it is a compounding effect. These conditions can all be the cause of lack of appetite, together with other underlying issues and underlying causes, which are so many. A cat can stop eating for so many different reasons. But the nut of the matter is that you are facing a situation where you have to assist feed your cat, because otherwise, I mean, cats cannot really survive without food for a long time. And also, well, nobody can really, but particularly cats cannot go beyond a certain number of hours. I put my limit at 12 hours, and of course a cat can be okay even beyond the day mark. But when it starts to be 36 hours, I mean, you want to get something inside your cat, and you want to get them to eat nutrition, proper nutrition, because otherwise they can get further complications with hepatic lipidosis. They can develop liver disease, and this can be or triaditis, and this can be a much bigger problem that needs to be treated with hospitalization and things like this. So in all these situations, what I want to say to you here is that you definitely want to get your technique down to a T. So you want to practice, you want to try and practice as much as you can, because for each of these conditions, there is a way that you can go about it that makes it easier to feed your cat. Now, I can't just sit here and tell you, go by this angle and 30 degrees angle, and put the syringe from the top and tilt the head up. Is not like that. You know your cat best. Some cats allow you to sit behind them comfortably, and this allows you for a sense of control and a degree of control over their posture, and they will allow you to hold their head from the top and slowly tilt the head towards the the ceiling, for example. And in this case, you can probably look inside their mouth when you quickly provide your syringe feeding inside their mouth. But some other cats will hate for you to sit behind them, and they will only accept syringe feeding if you're sitting in front of them and maybe they are sitting near the wall, because of course you don't want your cat to run away. It has to be something that is in cooperation, but there is a degree of, sometimes cats accept it, but they don't necessarily love it. So when you are in a necessity and you need to syringe feed your cat, and you need to give them the appropriate number of calories, because syringe feeding a liquid treat won't do, then in this case you need to make sure that your cat just doesn't run away, and you go, oh well, my cat doesn't really like it. Well, we need to find a solution. We need to find a way to cooperate. So I do sit in a way that prevents my cats from leaving, but at the same time, I treat them very nicely. I talk to them very nicely. I use my voice to soothe them. I use my hands to cuddle them while I do this. And then when it's time to put the syringe in their mouth, I compliment them. And this is the attitude, part of the attitude of the team formula. So the technique is one, and we just mentioned it. And then the attitude that comes at the third spot and the third place. This is what you have to do to make sure that your cat offsets. You offset this procedure with things that are positive and a lot of encouragement. And of course, if your cats are a little difficult and to handle, as I said, in the Jumpstart, we address all of that, because before you syringe feed, you probably have to get to a point of handling that is a little bit more comfortable for both of you. So we were talking about the team formula. So the technique is very important. And for each of these conditions, for example, when there are breathing situations, the breathing issues, then what you want to do is making sure that you can insert very little food at a time, so that your cat doesn't have all of a sudden a lot of mixture in his throat, and trying to cope with the breathing that is not easy, and the extra food that is going down their throat. So you want your cats to be able to swallow and be done with it and so to give them very, very small amounts. And at this point, the technique changes according to who your cat is, and also what they like you to do with them, and what they accept, what they don't accept, their previous traumas, because some cats do not want to be touched in a certain way because they've been through trauma before. But you will find a way to handle your cats, and once you are there, then the technique is very important, because all these situations, for example, with nausea sometimes, or with mouth issues, sometimes your cat will start smacking their lips frantically when you approach them with the syringe, because they just feel a bit of discomfort if this mixture of food swirls in their mouth. So it will be your job to assess how quickly and which angle and you will find it by practicing. There is no way you can do it in your head. You have to try, and you have to practice at first with very small amounts of food, always small amount of food. We're not gonna squirt 20 milliliters of food in one go. Of course, it's always small amounts. With patience and with a lot of good attitude, you will be able to. You have to be a bit resilient, of course, because sometimes these things are really tough. Your cat will sit there smacking their lips, and they will not want you to feed them, and they will feel, you can see that they will feel a bit uncomfortable, but there is no option. You've got to feed your cat, and you can't just leave your cat without food, and without nutrition. So obviously this needs to be done. So you have to find a way to be resilient, to make it a matter of fact, and to go at it with your best attitude, a positive attitude, a lot of encouragement, and bring your towels, bring your equipment. We now transition into equipment, for example, and make sure that you bring everything that you need before you start. So maybe have a little tray with you where you have a wet towel that you can use to clean up if it becomes a little messy, because normally syringe feeding shouldn't even be messy. You don't need to wrap your cats in a towel. You don't need to do any of this if you go through the training to get to that cooperative care that is the secret to actually do this in a simple and easy way. So generally it shouldn't even be messy, but in these cases it can be a bit messy, because your cats that are feeling, for example, nauseous will struggle with food in their mouth, because it will make them feel even more nauseous. So they might drool a little bit more. So if you are ready with some towels and you comfort them and you encourage them and swiftly clean them, they will feel immediately better, and you will feel better too, because you will have less mess, and obviously it'll be a much swifter procedure. And then, of course, things like problems with the mouth can imply pain when you insert the syringe. So you need to see if there is a particular place that your cat prefers you to go from with the syringe rather than another. So see how your cat is feeling. But the concept here is to perfect your technique for sure. Bring the equipment that you need. Absolutely bring good equipment, because you really don't want to be in this situation where you're trying to syringe feed your cat, you're trying to help your cat, and you are doing your best to do this in a very quick and smooth way, and then you get there and your syringe is not working, or it squirts everything in one go, and it just makes everything wrong, and this is just very upsetting. So go for the good equipment, get a really good quality syringe, get your mixture to be room temperature, and make sure that you check that it is the right consistency, and make sure that you check that this mixture is a high quality. In the Jumpstart, we discuss all about this. I have a full module on that teaches you how to get to a point of mastering this technique and basically prepare their food in a way that fits with your routine as well, because we all have lives, and this can become quite busy at first as you figure out how much you need and how to prepare it. But I have a full module that tells you all of this and walks you step by step and takes you by the hand to understand exactly what you need to do as fast as you can, because you don't want to waste time. If your cats need assisted feeding, you want to get in there and get going as fast as possible, because you can't really wait a week to figure it out. You need to figure it out pretty fast. So that's why I want to help you with this material and this content, because I have gone through so much of this, and I have perfected the techniques, I have perfected the equipment, I have all the advice that I can give you, and I am so happy to help you. And I want to stress that you need technique to be on point, you need your equipment to be on point, you need your attitude to be on point, you need your attitude to be really positive as much as possible. I know it's hard. I know sometimes we can suffer from compassion fatigue, where we get to a point of caring and doing so much for our cats, and things are hard sometimes, and we have lives that are busy, and we all have issues in our lives, but it makes it easier if we have this process down to a T, and we can get through it, and we can get to support our cats with the feeding, so that we get one thing under control, and then we can move on. Because sometimes cats don't want to eat for a period of time, with this procedure and with this process that you can do at home, this can bridge to the next stage. And then you can get to the stage of being a little bit more on top of it. And then your cats might just like to eat on their own. Slowly but surely, things will get better. And this is how you overcome the issues that you can face at some point. So, and your cats will come out the other side. So, yes, the last thing is metrics. In this case, I'm not going to dwell on metrics, but what I want to say is that it's always important to write down what's happening, how often you feed your cats, their weight, and a number of data. And of course, in the Jumpstart, I've got hundreds of trackers and training that gives you all the elements that you need to keep in mind when you track things, and you can pick and choose what you need for that particular situation, and it's all ready for you so that you can go to the vets and show them exactly what happened. Because when a cat is sick, or maybe you have more than one cat that has fallen sick, and you all of a sudden need to remember which meds and at what time and how much feed, and it's quite challenging. You can't keep everything in your head, and we already have busy lives, and it's difficult to keep everything in your head. And then you go to the vets and you're like, oh, I'm not sure. Yeah, he vomited, I think it was 2 days ago. Yesterday, oh, we had loose stools, I think it was morning. And when you write it down, yes, I gave him this much food and I did this, and he didn't vomit. He vomited 2 days ago, but then I gave him this medicine at this time, and you have it all written down. It's so easy for you to just write it down and move on with your life. So this is done for you to help you basically, and to help you go through a crisis. And I know that you might need some help if you're going through a crisis, because it's not easy. It can be quite challenging, actually. I hope that this video is useful, and I hope that it helps you. And I am sorry if you are in a situation where syringe feeding is a little challenging, but if you are struggling, if you want guidance on how to succeed with syringe feeding, and also a lot of other things that imply you giving a high level of cat care at home, book a call. I offer a Help Your Cat call, which is also called the Catalyst call, and this is a free call, a free consult that I offer for you to know what your next step is, and to see if I can help you further, and to give you support as well if you are struggling. So there is an application for this, because obviously I have limited capacity, but if you do need support, please don't hesitate to fill the application. I will put the link down below. And yeah, simply Help Your Cat call, just apply, and hopefully we will get to a point to give you some more support. So if you're struggling with syringe feeding, don't lose hope, don't give up. Your cat needs you, and this is a skill that can totally be learned. If you need support, I can definitely help you if you want to master this practice as fast as possible, because you need to provide assisted feeding to your cats. Apply for the Help Your Cat call, and I will be in touch so that we can hopefully jump on a call and have a chat and get you some support. So on this note, I will see you next time, and until then, love your cats as much as you can.